Now, half a dozen newly born babies and mothers have died in the past 6 years at an island community of Faana in the South municipality of the Greater Accra region. That is according to the residents of the community trapped in between the sea and a lagoon with no access to healthcare. Other inhabitants and pregnant women continue to die and deliver in canoes as a result of traveling for over an hour to in-paddled canoes to access healthcare. Joy News' Henry Kwesi Bedu returned from the community and has more in the following report.
35-year-old Kwame recounting how her wife in 2018 delivered their first child in a canoe en route a chief's compound miles away from the island community.
I went fishing when my wife was in labor. She delivered on her way to the hospital in a canoe. The hospital is very far from where we live. I was afraid something might happen to my wife because the health center was a distance away.
His wife is lucky to have survived, but the fisherman is worried because his wife is now 7 months pregnant, expecting a second child soon.
I am now afraid that something may happen to my wife the next time she labors.
The only way to access the community is by canoe. With no electricity, water, and other basic amenities, pregnant women and other members of the community in dire need of health care will have to risk their lives by sitting in paddling canoes without life jackets for close to an hour to reach the nearest health facility.
There is no clinic here. There is no anything that can help an individual or people here so that they will be able to give birth. That is why normally when they're in a labor, people normally convey them in a boat to Chokome or the other side, that is Pamblos, before they can do deliver.
Rosemary Dassi is also a resident here. Her water broke in the dead of the night last year. With no canoes operating in the night and no traditional birth attendants, she had to wait for 4 hours to get a canoe, enduring severe pains and putting her life and the baby on the edge.
It started around 1 a.m. I felt funny, and my husband called his mother and grandmother. They confirmed my time was due. The canoe came around 5 a.m.
Rosemary delivered, but she does not want to relive the same experience.
I was in pain, and I couldn't sit in the canoe. After an hour, we got to the banks of the river, and I was told to quicken my steps. I got to the hospital and delivered safely, but it was a horrifying experience.
Pregnant women aren't the only victims here. Other sick persons face similar challenges too. They rely on first aid until they get access to canoes, which are not readily available.
Now, South Health Director Dr. Abna Oko has been reacting to this.
There's been several communications going back between Assembly and the Health Directorate, as well as with the national level. We've written for support. We've also written for support like boats to even make it easier for health staff to even go there more often. We are still in communications with Assembly so that a compound in the near future can be built. So these communications are still ongoing.
All right, briefly, Doc, you said that you send two community health nurses go there twice every month to take care of children, especially give them life-saving vaccination. So what happens to other people who report with other conditions or ailments?
All right, so the community health nurses, what they do is that they give you first aid. So after the first aid, or if the issue you come with is beyond what they can do, they will refer you to the closest facility, which is Chokomeche Zone or Botiano Health Center. What they do is giving you the first aid or the counseling, the first things you can do to prevent any fatality.